Cardiovascular system, palpation. Technique. The evaluation of the cardiovascular system includes a thorough medical history, a detailed examination of the heart and the peripheral arterial and venous circulations, and appropriate laboratory studies. A careful assessment will enable the examiner to identify the etiologic, anatomic, and physiologic components of a specific cardiovascular disorder, as well as to determine overall cardiac function. The examination involves inspection, palpation, and auscultation of the heart and vessels. What to observe while palpating: apex beat, parasternal heave, thrills, any palpable sounds, any other pulsations. Procedure. Introduce yourself and confirm the patient's identity. Ask for the patient's consent before beginning. Ask the patient to remain in sitting position. If unable to do so, examine the patient lying quite straight. Make sure your palm is warm before palpating any patient. Place the palm of the right hand over the patient's left chest such that the palm covers the area over the heart. The heel rests along the sternum border with the extended fingers lying below the left nipple. Feel for the apex beat in the fifth intercostal space 1 cm internal to the mid-clavicular line. Note the position, area, amplitude, and character of the apex beat. Next, feel for parasternal heave by placing the hand parallel to the sternum at third and fourth intercostal space on the immediate left of the sternum. Next, feel for thrills at the apex, second intercostal space right to the sternum, second intercostal space left to the sternum, and fourth intercostal space left to the sternum. Next, feel for any other pulsations at the root of the neck, at the front of the chest, and in the epigastrium, just below the xiphisternum. A pulsation in the suprasternal notch indicates aneurysm of the arch of aorta. Visible carotid pulsations may be observed in thyrotoxicosis, hypertension, aortic regurgitation, aneurysm of aorta, or in anxious patients. A pulsation on the right of the sternum may be observed in aneurysm of aorta if the ascending aorta is affected, under the manubrium sterni if the aortic arch is affected, and on the left of the sternum if the descending aorta is affected. Pulsation in the epigastric region is observed in thin patients who are nervous or excited, or in tricuspid regurgitation. Physical findings must be interpreted in light of all previously collected data. The general scheme is to develop a postulate and test it with further history, additional observations, or maneuvers on physical examinations and laboratory tests.